Many women are unaware of the consequences on breast cancer treatment on their pelvic floor. My name is Dr. Brooke Kalasiak. I'm the owner of Legacy Physical Therapy in St. Louis, Missouri, and I'm passionate about helping people optimize their pelvic health. The pelvic floor muscles are a bowl of muscles on the bottom of our pelvis that support our pelvic organs, and they help to maintain normal bowel, bladder, and sexual function and help with core stabilization. So they are a very important group of muscles. There are several different types of breast cancer treatments that can have an effect on our pelvic floor region. We're going to go over a couple of them. Surgeries, mastectomies, and any subsequent reconstructions can cause posture changes, changes in our ability to breathe, and changes in our core canister to be able to support. All of this can have an effect on our pelvic floor. Chemotherapy treatments can cause muscle wasting, lessening or decrease in muscle mass, fatigue, and decreased activity tolerance, which again can significantly affect how our pelvic floor can function in our day-to-day life. Radiation therapy, if the pelvic region is involved, then we can develop scar tissue in the vaginal canal, which may lead to sexual dysfunction and pain in the pelvic region. Hormonotherapy, it is very common for many breast cancer patients to undergo treatment that can lower their estrogen levels. And if we're using anti-estrogen medications, this can have an effect on our pelvic floor by causing it to atrophy and cause vaginal dryness and irritation. Some of the common pelvic floor conditions that can result from breast cancer treatments include bladder leakage and urgency and frequency, pelvic organ prolapse, which is a dropping of the pelvic organs into the vaginal canal, and there's several different types that can occur. Pain with sex, this can be a result from vaginal dryness or irritation to the tissues, and chronic pelvic pain, where the tissues maybe aren't moving as freely as they should be, and people end up with pain conditions throughout their daily life. The good news is if you are experiencing any of these pelvic pain conditions or bladder leakage issues, that there is help. You do not have to solely live with these issues. So here are a couple suggestions of things that you can do to try and help alleviate these symptoms. First is pelvic floor muscle training. Our pelvic floor muscles are that bowl on the bottom of our pelvis, and a contraction of the pelvic floor is considered a Kegel exercise. Think about drawing up and in around the vagina or trying to stop the flow of urine. That is a Kegel exercise and a contraction of the pelvic floor. But know that the muscles also need to relax and stretch and let go. So doing that nice contract and relax back and forth can be helpful. Second thing that can help are lifestyle modifications. So maintaining a healthy weight, making sure that you're drinking plenty of fluids throughout the day, having regular bowel movements, urinating every 2 to 4 hours, and exercising 20 to 30 minutes at least 3 to 4 times a week can make a significant improvement on your pelvic health symptoms. The third option is partnering with a pelvic physical therapist, where we can assess and evaluate what is going on specifically with the muscles in and around your pelvic area and come up with an individualized treatment plan to meet your needs to achieve your symptom reduction. The impact of breast cancer treatment on pelvic floor function often gets ignored and can get pushed to the side, but I'm here to tell you that this is something you should be discussing with your healthcare team. It is an important component of survivorship and thriving after diagnosis. Please know that there are treatments and interventions available to help, and you are not alone. These issues are common, but they're not normal, so don't hesitate to talk to your healthcare provider about them to seek the care that you deserve.